But the question is, could healthcare reform really happen? Could it really happen this year? Finally. Today, I asked that of Speaker of the House, Nancy Pelosi. And he says healthcare reform this year. Can healthcare reform be done this year, really?
It's a priority of the President of the United States. It's always been a priority for the Democrats in the Congress. We want to work in a bipartisan way, but it is absolutely essential. It's essential to everything, not only the personal well-being of individuals, which is, of course, our top concern, but if you're going to, for example, have entitlement reform, you must have health care reform. The rapid increase in cost of health care is the biggest contributor to our concerns about, shall we say, Medicare, Medicaid, and the rest. So it's about individuals, it's about our national budget, it's about the health of America. It has everything going, and it's an economic issue, of course.
Is entitlement reform contingent on health care reform happening first? Is it not worth approaching Medicaid and Medicare reform, for example, without having approached health care costs in a bigger way?
No. You have to start with health care reform, reducing the rapid increase in cost of health care in our country. And again, health care reform is entitlement reform. And you put it all on the table.
You got that, Republicans? You want to see any changes to any entitlements? Medicare, Medicaid, any changes at all? Social Security, maybe even? Only if health care reform is completed first. If the Republicans in the House treat health care politically the way they treated the stimulus and they decide to say no, would you compromise the quality of a health care reform proposal to try to chase their votes, or would you just let it pass with 0 Republican votes if it came to that?
Well, I think my record is clear on this subject. I want bipartisanship to the extent that we are making progress, but we're not going backward. If I had to use 4 words to describe on all of our initiatives, whether it's rebuilding the infrastructure of America, keeping America competitive and #1 through innovation, whether it's global warming or healthcare, I would use these 4 words: science, 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 and science. That's what it's about. So we want to have the best scientific basis and the best scientific methods as we go forward to put together this healthcare reform. And we want bipartisanship. Too many people are involved, too much money is involved. We want to have as much legitimacy as possible as we go forward. And I think this is a national debate. It's not just in this chamber or the Senate chamber. It's a national debate for our country. And so we have to bring people together. But while we may want to respect views on tactics or different provisions, we cannot dilute the health care prevention, customized, personalized care, the universality, because it all feeds together to make America healthier.